I'm very proud to provide excellent care to children in the United States. But in the back of my mind, I always had the feeling that I should help children in India. My name is Prakash Satwani. I take care of patients at New York-Presbyterian and Columbia University Medical Center who have blood disorders. Majority of those patients are patients with leukemia, lymphoma. I was born in the city by the name of Bhopal. We lived in a small area considered as a slum. This is the street I grew up, and the house here, it used to be a mud hut which had cows in one area, and we were living in the small portion of that house. My mother worked extra odd jobs to help pay for my school. I was in 8th grade, and my younger brother, he was in 5th grade. He started to develop high-grade fevers. We took him to a pediatric specialist in Bhopal. He said that he has leukemia, which was a shock for us to hear. In Bhopal, there were no centers which could treat leukemia. We took him to a hospital in Indore. Ultimately, my brother did not get treated for his leukemia. And when they were traveling back from Indore, he died en route. That obviously was a big turning point for me. That helped me to consolidate my feeling of becoming a physician who can take care of children with cancer. Also, my mother only wanted me to do one thing, is to study hard and become a doctor. So I worked at medical store. It is a smaller version of pharmacy where you only sell medicines. I worked here for almost 16 years of my life. I came to New York-Presbyterian Hospital and Columbia University Medical Center in 2002. I take care of patients with leukemia, lymphoma. Leukemia is overgrowth of white blood cells. Not only white blood cells are high number, but they are abnormal and they continue to proliferate. On the other hand, lymphoma is a disease which arises in lymph nodes. We have to treat both leukemia and lymphoma with chemotherapy. Only small number of patients who do not respond to treatment are eligible to get bone marrow transplantation. On an average, we do 30 to 40 bone marrow transplants each year. In Western world, patients with blood and bone marrow disorders can get state-of-art treatment and have a good chance of living a normal life, but that is not the case with children in India. After listening to my philosophy and understanding my vision, government of Madhya Pradesh agreed to set up a bone marrow transplant unit in Indore. This is the Maharaja Yashwantrao Hospital, which is in Indore, and this is the hospital where we have our bone marrow transplant unit. 2018, we did first 2 bone marrow transplants in India. I spend most of the month in the unit, including sleeping, to make sure that there are no breaks in the care of these patients. This is a very unique center. All the nurses and doctors are together talking about the patients, where majority of the patients are getting cured despite having no financial resources. This is one of the patients' room. While I'm here in New York, I'm in touch with my team in Indore at the Bone Marrow Transplant Center every day, 24 hours a day, 7 days a week. Every child, rich or poor, has a right to a healthy future. When I go back and when I see Mom, I want to tell her that her vision is making difference in lives of children, not only in India, but also in the United States.